One of the things that's really important to learn about is pneumonia. Pneumonia is potentially a life-threatening condition. Sometimes we call it walking pneumonia or ambulatory pneumonia, something we're able to treat in the office or at home. Oftentimes it can get much worse. Pneumonia is also a spectrum of diseases. One end is viral pneumonias, a little more challenging to treat, a little more challenging to identify, but that's what we do, we're experts at that. On the other end is bacterial pneumonias. More commonly that people may be familiar with is strep pneumonia or streptococcus pneumonia. You may have heard of MRSA pneumonia. Sometimes people who've been in the hospital a long time can develop an MRSA infection, methicillin-resistant staphylococcus pneumonia. Other forms of pneumonia may be Pseudomonas pneumonia if you have underlying COPD or chronic bronchitis. Our job is to identify those, whether it's by collecting your spit or what we call sputum and measuring it and putting it in a culture plate so we can grow the bacteria, so I can specifically target the type of antibiotics that will be best for you to treat that infection. Our job is to deliver personalized medicine. That means medicine that's tailored specifically to you and the etiology or the cause of your infection. Pneumonia can spread in the lungs. You may feel shortness of breath, coughing up, not just whitish sputum, but changing color, thick, greeny, sticky sputum, getting worse and worse to the point where you can't get it up anymore. Run a high fever. You notice that maybe you have a rash on your skin or that your heart is racing. These are all measures of how severe your pneumonia may be. We get a chest x-ray, we get a CT scan of your chest to see where in the lung is this infection at. Our job is to make you feel better again. Our job is to help you breathe better again. If you have any of these symptoms, coughing, fever, chills, rattles in your chest, come to the office for an evaluation so we can work this up. And then once we start the antibiotics, it sometimes takes 7 to 10 days for you to improve. But our goal is to avoid any hospitalizations, treat you early and aggressive so that you'll improve and live a long, happy, healthy life. Our job is to help you breathe better again.